Welcome back to The Explainer. Today, we're diving into some complex research and breaking it all down into clear, actionable insights. We're talking about a silent hitchhiker. Seriously, it's this invisible threat that could literally be hiding right now in the dust of your attic, your basement, or that backyard shed you haven't opened since last summer. Yep, we're talking about the Hantavirus. Now, this isn't the kind of virus you see dominating the 24-hour news cycle, but as you'll see today, it is a fascinating and absolutely serious medical anomaly. We're going to figure out exactly what this virus is, look at the two drastically different ways it attacks the human body depending on where you live, and most importantly, we're going to show you how to build a practical, everyday shield around your home to keep you and your family completely safe. Okay, let's dive into this. Here's our roadmap for today. We'll kick things off with the hidden threat of the virus, map out the two distinct syndromes, trace the symptoms and progression, and look at the routes of infection. And then we'll wrap up with the practical stuff, protecting your home and the rules for safe wet cleaning. All right, let's jump right into Section 1, the hidden threat, Hantavirus. To really get what hantavirus is, we first need to tackle the word zoonotic. Basically, hantaviruses are a family of zoonotic viruses, which just means they're pathogens that naturally live in animals, but every now and then they make the jump to humans. In this case, the natural hosts are rodents. But here's the really wild piece of the puzzle. These viruses live long-term inside these mice and rats without actually making them sick. For the rodent, the virus is just kind of a silent passenger. But when that virus accidentally jumps over to a human, well, it suddenly finds itself in a biological environment it just isn't used to, and it panics, causing severe, sometimes life-threatening illnesses. So it's not some monster out to get us. It's really just a microscopic agent hanging out in its natural reservoir, but it becomes a hidden threat the second our two worlds overlap. Moving right along to Section 2, two syndromes, HCPS and HFRS. This is where the biology gets incredibly interesting. And this brilliantly illustrates what I mean. This virus is essentially a geographic shapeshifter. Depending on where you stand on the globe, it acts like two totally different diseases. Over in the Americas, we see HCPS, Hantavirus cardiopulmonary syndrome. It moves fast, it's incredibly aggressive, and it targets the lungs and the heart. But if you travel over to Europe and Asia, the virus manifests as HFRS, hemorrhagic fever with renal syndrome. It's the exact same viral family, but a completely different target. Instead of the heart and lungs, HFRS goes straight after the kidneys and the blood vessels. It's a stunning clinical difference, and it completely changes how doctors have to monitor and treat patients based entirely on their region. Which brings us nicely to Section 3, symptoms and progression. So how does this actually unfold in the human body? Well, early diagnosis is, quite frankly, incredibly challenging. Initial symptoms don't even show up until 1 to 8 weeks after exposure. That is a massive window. I mean, you could clean out a dusty garage in early May, forget all about it, and not feel sick until late June. And when you finally do feel sick, what are the symptoms? You're looking at fever, headaches, muscle aches, and abdominal pain. Whether you have the American lung targeting strain or the European kidney targeting strain, the early phase disguises itself perfectly as the regular flu or just a standard stomach bug. It literally hides in plain sight. But unfortunately, that disguise eventually drops, revealing a really severe clinical progression. For HCPS in the Americas, the disease spirals into a full-blown respiratory crisis. We're talking severe cough, sudden shortness of breath, fluid rapidly filling the lungs, and ultimately cardiovascular shock. It's basically a rapid, terrifying lack of oxygen. Meanwhile, over in Europe and Asia, HFRS triggers a hemorrhagic and renal crisis. Those patients suffer from dangerously low blood pressure, serious bleeding disorders, and acute kidney failure. Remember, these are two entirely distinct medical emergencies, but they stem from the exact same family of viruses. Now, what's really interesting and honestly pretty alarming about this slide is how those clinical differences translate into survival rates. In the Americas, that respiratory syndrome, HCPS, can have a fatality rate of up to 50%, literally a coin flip. Half the people who contract it could die. Compare that to HFRS in Asia and Europe, where the fatality rate ranges from less than 1% up to about 15%. Now, make no mistake, both are incredibly severe, but the cardiac and pulmonary shock from the American strains presents a dramatically higher risk of death. The stakes here are absolutely huge. Let's look at Section 4, routes of infection. With stakes that high, we really need to know, how do we actually catch this thing? Well, the answer is right in our environment. Remember, the virus lives in rodents. So humans primarily get infected through contact with contaminated rodent urine, droppings, or saliva. Occasionally, you might get it from a bite, but that's pretty rare. The real danger zone isn't necessarily seeing a rat run down an alley. It's enclosed, poorly ventilated spaces. Imagine sweeping out an old barn or cleaning up a shed, or even working in forestry. You disturb dried rodent droppings, and the virus gets aerosolized. It basically hitches a ride on dust particles, floats right up into the air, and you just breathe it in. So, what does this all mean for us? That brings us to the absolute most important question of this explainer. How do you protect your home? We know the medical facts now. We know the high risks. We know exactly how it spreads. Now let's empower ourselves with some simple, actionable solutions to shut this thread down completely. Welcome to Section 5, Protecting Your Home, where we lay down the foundation for prevention.
So the crucial point here is eliminating that overlap between the rodents' world and yours. First things first, seal up your home. Mice are incredible escape artists. They can squeeze through a hole the size of a dime. Literally. So walk around your foundation, check your weather stripping, and plug up those tiny gaps. Second, just keep a clean environment both at home and at work so they don't have anywhere to hide. And third, store your food securely in thick plastic or metal containers. It's simple logic. If you take away their access and you take away their food, the rodents won't stick around. And if they leave, the virus leaves with them.
Finally, let's head into Section 6, Safe Wet Cleaning. What do you do if the rodents have already been there? Okay, pay attention because this is where so many people make a critical mistake. Never, under any circumstances, use dry sweeping with a broom or a standard vacuum cleaner on rodent droppings. No way. When you use a broom, you are just whipping that hantavirus straight up into the air. You're turning a hazard that was sitting safely on the floor into a breathable, deadly dust cloud. You are literally aerosolizing the virus. Let's move to and see how this builds into a much safer method. Instead of sweeping, we absolutely must use a wet cleaning alternative so we don't create any dust. Step 1, dampen the contaminated area first. Grab a commercial disinfectant or just a mix of bleach and water and spray it directly onto the droppings or urine. Let it soak. This actively kills the virus and, crucially, weighs the dust down so it can't float up into your face. Step 2, simply wipe up the material with wet paper towels or a wet mop instead of sweeping. And finally, Step 3, rigorous hand hygiene. Go wash your hands thoroughly with soap and water right away. It is a super simple, totally dust-free methodology that effectively shields you from infection. As we wrap up this explainer, I want to leave you with this powerful thought from the World Health Organization about their One Health approach. Basically, our health doesn't exist in a vacuum. It is deeply, fundamentally tied to the animal reservoirs and the shared environments all around us. By understanding the real clinical differences of this virus and by respecting those invisible pathogens that rodents leave behind, we take back control of our spaces. You've got the knowledge now. You can recognize the symptoms, you know how to seal up your home, and you know how to clean up safely without ever kicking up a speck of dangerous dust. So the next time you open the door to a dusty, untouched shed, just ask yourself, what invisible ecosystems are we unknowingly stepping into, and are we truly prepared to coexist safely? Thanks so much for joining us. Keep learning and stay safe out there.